Hello, and welcome to this presentation that's an overview of World Vision's COVID-19 vaccine guidance. I'm Tom Davis, Global Sector Lead for Health and Nutrition. So World Vision's strategic intent is to use our global reach and grassroots connections to encourage vaccine acceptance and uptake by the world's most vulnerable communities to save lives, protect livelihoods, and safeguard families and children from impoverishment and violence. Some organizations are focusing on getting vaccines to arms. We're actually working on getting arms to vaccines, really on that demand side of COVID-19 vaccines. I suggest you take a look at World Vision's COVID-19 vaccine response capacity statement and ensure that your health and nutrition staff and others have access to this important document. As you can see by the table at the bottom, vaccine acceptance varies widely in a lot of our countries, from 40% in Kenya to 81% in Bangladesh. So we have a long way to go to make sure that everyone is being vaccinated. And down below also you'll see a link where you can check on other countries. This shows the COVID-19 vaccine rollout in Africa, both those countries that have received vaccines and countries that have begun vaccinations as of March 5th of 2021. So quite a lot is happening in this space. Note that 78% of vaccine doses have been administered in only 10 countries, and there are not many of our countries in that list. So we really are hoping that vaccines will get out to more and more people, but we have a time here we can really focus on preparing people and ensuring that the acceptance will be as high as possible by the time those vaccines arrive in countries. So let's talk about World Vision's role in this space. Note that World Vision will not be involved in these sort of activities. We won't be involved in procurement or importation of vaccines. We won't be directly administering or dispensing vaccines or involved in selection of priority populations. That's the government's role. We'll not be involved in treatment of adverse effects of vaccines or create or support parallel coordination structures to those established by the MOH. We won't implement any communication or community engagement interventions that are parallel to the Ministry of Health and not aligned to that national vaccine deployment plan. We won't develop or disseminate any vaccine uptake content messaging that's not reviewed and approved by Ministry of Health. So we need to make sure we're working closely with them. And we won't support rollout of any vaccine that is not approved either directly by the WHO or a stringent regulatory authority and which has not been officially registered by the national government. We will not support any mandatory vaccination campaigns as well. And note that we do have some new guidance in a question and answer format on this question of what you do when a government is promoting vaccines that have not been approved by a stringent regulatory authority. This is our main guidance in this area, promoting COVID-19 vaccines through World Vision field offices, a step-by-step programmatic guidance and checklist. Robert Gunwagi on our team is not only one of the main authors of this, but featured on it, receiving another vaccine. So with the purpose of this is to understand World Vision's best opportunities for national COVID-19 vaccine rollout and support, to prioritize engagements, interventions, and advocacy, to apply best practice to this support, and the guidance recommends that all field offices conduct at least one barrier analysis as a way to better understand what those drivers are of vaccine acceptance in your country. So these are the steps in increasing demand of COVID-19 vaccines that are laid out in this guidance: securing high-level political support, conducting formative assessment using barrier analysis in particular, understanding the national plans and aligning your strategy with the ministries of health, and identifying and leveraging stakeholder partnerships. So you see there's a lot there in just working with other partners to begin this process. Then identifying and advocating for most vulnerable groups and reducing gender barriers. And we need to understand everyone's role in this. So there's a section in the guidance that kind of explains what everyone should be doing. One of the main pieces of this is leveraging your core project models to promote COVID-19 vaccines, especially the CHW, Nurturing Care Groups, COM, Channels of Hope, and the CVA core project models. Also, we need to remember that we still need to be providing PPE and continue to advocate for other protection measures, that we're not just advocating for vaccines, but for continued use of masks, social distancing, hand washing with soap. These other things will be important until everyone is vaccinated, or at least until we reach herd immunity. Also, conducting national level advocacy. There's a section in there on how to do it and what tools are available, and conducting capacity building and communication and behavior change for the vaccine rollout. Some of the other recommended but kind of second tier interventions involve vaccine communication, community engagement, and compliance gap analysis, using mobile online training and support and for supply chain support, the MOTS, which we're going to have some forthcoming guidance on that. Using mobile messaging for vaccine compliance, or MOTEC. Use of mass media for risk communication and supply chain support. So these are more second tier, but we hope that some of our offices will also take a look at that guidance and use it. We do have some recommended global standardized indicators. I won't go through all of these, but they include like objectives, indicators around our objective of scaling up preventive measures to limit the spread of disease, of strengthening health systems and workers, and collaborating and advocating to ensure children are protected. This is a long list here of some of the support tools we have available, but when we distribute these slides, you can click on these links to see that vaccine capacity statement that I mentioned earlier, this programmatic step-by-step guide that I've gone over. There's an accompanying checklist that we just developed that makes it easier to see if you're basically doing the majority of the things that are in that step-by-step guidance. We also, of course, are going to be talking about the Channels of Hope module for COVID-19 vaccines and the CVA version that focuses more on COVID-19 vaccines. And we do have bear analysis result summaries and tabulation tables for India, Myanmar, Bangladesh, Kenya, Tanzania, and actually DRC as well. And those can be accessed through StoryHub. We have another link if you need it, if you have trouble with that. Bear analysis tools for COVID-19 vaccines have already been developed, such as the BA training guide, which you've seen before, most likely. We have a COBO questionnaire. We have a paper Microsoft Word questionnaire for that. We have an updated bear analysis tabulation table and instructions. And we also have bear analysis questionnaire to assess religious leaders' promotion of COVID-19 vaccines. It's been developed that you can access in COBO or the paper version. And we have a question and answer on COVID-19 vaccine approval and vaccine hesitant countries, which I mentioned, that is being added to the all-in-one messaging, and other advocacy tools and resources that will be presented later in this webinar.